Hello, my name is Dr. Jeffrey King, and I'm a board certified orthopedic hand surgeon. And I'd like to talk to you a little bit today about trigger finger. Trigger finger is a very common problem that we see, and it manifests itself most by a clicking or locking sensation in one of your fingers. Now, sometimes it can start with just painful stiffness of your finger that makes it hard, and sometimes that can make it difficult to differentiate from arthritis in the hand. The other presentation is sometimes people will have clicking and locking where their finger will get stuck and they have to unlock it. And that can be painless. So at one end of the spectrum, we have stiffness, but no mechanical clicking and locking. The other end of the spectrum, we have people that have mechanical symptoms, but no pain. The most common presentation is actually people that have clicking and locking, which is painful when it's happening. So that's the general symptom presentation. Now, we don't know why this happens most of the time, but we know that what's going on is that your fingers move by tendons, which are like lines or ropes that run down from your muscle in your forearm all the way up to your finger. And those tendons in this area of your palm can get caught as they go through little tunnels. Now, people will often say, no, the problem isn't here, it's up there, because when they're moving their finger, that's where they feel the clicking. But the issue is actually that the tendon is getting caught inside a little tunnel right here in your palm. It's a relatively harmless, although annoying problem. It does not cause damage to the tendons. It does not necessarily spread to other fingers. So the biggest problem with trigger finger is that it's annoying and it's painful and it's uncomfortable. Now, it can happen in your thumb as well, but it's more, the most common finger is the ring finger, but it can happen in any of your fingers. So what are the options? How do we treat this? Well, the first thing I always tell people is that there's a chance it might go away. Now, we know it goes away in some people. It's just very hard to predict if it's going to go away in you specifically or how long that's going to take. But if someone says, can't I just watch it and see what happens? The answer is always yes. You certainly can watch it and see if it gets better. If it's not getting better, most of the people that come and see me, it's because it's not getting better. There are two other options. One option is you can try a steroid injection into this area of your palm, whichever finger is involved. And what that involves is a little bit of numbing medicine and then a little bit of steroid medicine that we inject with a very small needle right here into your palm. The idea being that the steroid medicine will shrink down whatever the swelling is, and that may make your symptoms go away. Now, that is completely effective and a cure about 50% of the time. The other 50% of people may get better for weeks or months, occasionally even years, but then the symptoms will come back at another time. So it's a relatively easy thing to do. It can be done in the doctor's office, but as a long-term cure, it works about 50% of the time. The other option is a surgery. The surgery is done on an outpatient basis, so you can go home the same day. And generally, we can either do it with a little bit of sedation to make you sleepy, or we can do it with a wide awake technique, in which case you wouldn't need the IV and you don't need to fast the night before and things like that. But in either case, what we would do is we would have you come to the surgery area, and then we wash your hand very carefully, numb up the area where you have the problem, and then basically at the time of surgery, we would make a little incision kind of right where the bump is that's clicking and popping. So we make a little incision about a half an inch long right there, and then my job as a surgeon is to go down there and find the little tunnel where the tendon is catching and locking, and we just release that. We open that up. Now, each of your fingers has a total of 5 pulleys. It's hard to believe there's that many in there, but there are. And so we're only releasing one. So that does not create a problem or cause a problem in almost all patients. So once we release that pulley, which takes just a few minutes, put a couple of stitches in there, and then we would put a soft dressing on your hand to protect it. You keep that clean and dry for a couple of days. After about 3 days, you take the dressing off. And then you can just put a Band-Aid over it, and at that point you can get it wet. So for the first 2 weeks or so, you can use your hand for holding a fork, holding a pen, buttoning buttons, zipping zippers, checking your email, nothing more than a pound. We don't want you leaning on your hand. We don't want you lifting anything heavy or doing anything particularly repetitive. But the triggering should go away immediately. So that's the good news. And then we see you back in about 2 weeks. Take your stitches out, make sure you're doing okay. And if you're doing okay, you don't need any other follow up, and you can get back to doing whatever you want. So I don't like the term minor surgery because I think the decision to have any surgery is important. But I think compared to complexity, like having a hip replacement or some other large complex surgery, this is much less complex and a quicker recovery. With any operation, there's risks. The risks are small, but they're real. And with any operation, there's a risk of infection. That risk is about 1%. It's higher if you smoke, have diabetes, take steroids, or other chemotherapeutic agents. But the risk is low, it's less than 1%. There's a risk of the surgeon injuring the tendon or the nerves or things in that area. We're very careful about that. That risk is less than 1%. There's the risk of a tender scar, which you will have a tender scar for a little while. That's very typical. But if you rub it and massage it, that usually goes away once your stitches are out. There's a risk that your triggering could come back again and you might need to have another surgery for it. That's extremely uncommon. Now, it's also possible that you can have other fingers triggered. So it doesn't mean that it caught it from adjacent fingers. It means whatever the problem is that gave you the first trigger finger, it can happen in other digits on the same or the other hand. And finally, there's a risk of anesthesia. If you have sedation, there's a small risk from the sedation. If you choose to have it with the wide awake technique where there is no sedation, then that risk is essentially zero. So that's a brief summary of trigger finger, how we diagnose it, what it is, how we treat it, and what the risks and benefits of the surgery are. Hopefully that's helpful. If you have further questions, please feel free to call my office or visit your local qualified hand surgeon for evaluation and further treatment. Thank you very much.